Okay, good morning, student, once again. So today, like whatever remaining now we have discussed, I would like to complete today. And if there is a time, then I will give you all at least like 5 questions, okay? 5 important questions. So let us continue fast. Okay. Okay, can you see the slide?
Yes, ma'am.
Okay. So now I would like to inform you all, right? Because there are in the management we have mentioned so and there are, apart from all the medicines that is being taken to reduce the this blood pressure that is associated with this renal disease so apart from all those medicine, okay, there are like there are also another lifestyle procedure to which you can also like reduce the blood pressure. So let us discuss. So the heading is how to prevent or slow the progress of kidney disease from high blood pressure. So because we are mainly discussing about hypertension associated with renal disease so now let us see what are those remedies or the precaution, okay, that you can take. So let us discuss how we can prevent or slow the progress of kidney disease from high blood pressure, okay. So the best way to slow or prevent the kidney disease from blood pressure is to take step to lower blood pressure. So if someone have any like blood pressure, high blood pressure, okay, so the step that you need to take, first of all, the first priority that you need to take is to lower the blood pressure. So let us see some of the step, okay. The step that include a combination of medicine as well as the lifestyle changes. So there that means like in order to prevent or slow the progress of this kidney disease, okay, from high blood pressure, what you can do is that you can means you can follow these two steps, that is the combination of medicine as well as the lifestyle, okay. Medicine ka matlab hai all the medicine that is angiotensin converting enzyme, angiotensin receptor blocker, or those medicine that we have discussed just now, all those are the medicines, so we won't discuss again. So now what we will be discussing is that the lifestyle changes. What lifestyle changes you can perform that will help you to reduce this blood pressure, okay? That comes from all the kidney diseases and all. So let us see one by one. Being physically active. So these are the lifestyle changes, okay? Being physically active. So being physically active means what? Samuel, what is being physically active? Samuel, physically
Ma'am,
active.
ma'am,
Yes?
ma'am, exercise करना और
Yes.
workout करना.
Yes, very good. So these are the other lifestyle changes or lifestyle modification, okay? Lifestyle changes that you can go through. So being physically fit means like regular physical exercise. This regularly physical exercise, this can lower your blood pressure, okay? And also it used to help us to reduce the chances of developing any other health problem, okay, any other health problem, क्योंकि exercise करने से बहुत अच्छा है. It helps to remove all the health problem as well as reduces our blood pressure, which is our first priority for today's discussion. And then they sometimes call it there's some aerobic activities. You can also perform the aerobic activities ka matlab hai like for boys and all by this biking, jo cycling and all this by cycling and all this is very much helpful. And then swimming and all these are very helpful. All these are the aerobic activities you can take, physical activities. So do you understand what are those physical activities that can reduce your blood pressure and also help you to prevent from other any health problem? You understand?
Yes, ma'am.
All of you?
Yes, ma'am. Yes, ma'am.
Okay. Okay, so so let us see, maintaining a healthy weight. Okay, maintain. And every time I used to tell you all that I will be discussing BMI, but as again now this I have to discuss this all this chapter and all now, like time is very less. I will just see means, and if I don't have like any time to explain also, I will try to send you all in the this. I'll write it down and I will try to send you the image and all now, so that it will be helpful to you all. So maintaining a healthy weight will also help a person in decrease the progress of the like this kidney disease, which is associated with the high blood pressure. Okay, so so like what you need to do is that if you are like overweight, okay, if you are overweight or if you are have like obesity means overweight. Okay, if you are overweight or if you have obesity, your first aim is always to reduce your weight. Okay, reduce your weight means like if you reduce your weight by like 7 to 10% during the first year of this treatment of high blood pressure, means like you are already having a high blood pressure. Okay, like, but the best way for you all, okay, the early treatment, the best way to reduce that blood pressure is not only the medication. If you reduce your weight to 7 to 10%, okay, that will also be very much helpful. Okay, so all those you can also follow. And then this to know the BMI, that is body mass index, okay, which I already just mentioned. So body mass BMI, to know the BMI is very much important. Okay, so BMI means BMI, this is a measure, okay, that is based on your weight in relation to your height. Means weight ka hisab se height means it will be based on your weight in relation to your height. Okay, so this BMI क्या है, body mass index जो है ना, that it can tell you that it can tell you if you are at a normal or like healthy weight or overweight, or you are having like obesity. All this BMI can tell you. So you just need to know is how to calculate. So then there are some like normal or like healthy range of this BMI ka na, BMI ka like range hota hai. So if you want to write it down, you can write down. I think some I remember. So if you want to write it down, you can write it down, BMI. So when you call like this normal or healthy weight, okay, if a person with a BMI of 18.5 to 24.9, okay, so 18.5 means 18.5 to 24.9. All this you can just write it down, BMI, like normal or healthy weight जो है ना, हमारा normal or body weight जो है, because our weight and our this height should be in relation. Okay, so normal or healthy weight is BMI. If the BMI is 18.5 to 24.9, okay, then you consider that a person have normal or healthy weight if his BMI. How to calculate? I will tell you all. And then overweight, when we call it overweight, it means if the person BMI, okay, that is body mass index is 25 to 29.9, okay, 25 to 29.9, then we call it as overweight. And then we call it as overweight. And then obesity means when a person with BMI, okay, 30 to 39.9, then we consider is that a person have obesity. So the next is like extreme obesity, बहुत ही ज़्यादा excessive overweight, okay, that is extreme obesity. The extreme obesity means if the BMI, okay, a person with a BMI of 40 or greater, okay, 40 या फिर 40 से ज्यादा, उसका BMI 40 या 40 से ज्यादा होने से he or she have extreme obesity. Okay, so what should be your goal? What should be your goal to maintain this BMI? What should be your goal? What should be your goal?
Ma'am, 18.5 to 24.9.
Yes, 18 form. Yes, that should be your goal. Okay, your goal should always be BMI lower than 25. Okay, that is 18.5 to 24.9. That is, and if you always maintain your this BMI in this, okay, in this normal range, then that will help you to keep your blood pressure under control. Okay. So this is very, very much helpful. So now what you know, you already know the value and all. Now what you know is you just need to know how to calculate, which I will tell you all later on. Is it okay? You understand? So with that, if you know all those value now, so then you will come to know that whether you have a healthy weight or not, whether you are obesity or not, all this. Otherwise, you can just predict that I am overweight, I am obese. You can just predict like that. So because everything is based on the weight and the it have it relations with the height. Okay. So if we if you know how to calculate the BMI, then will you be able to will you able to distinguish among all these point that I gave you? You are will you be able to know you are in which category? Normal, overweight, obesity, extra obesity, if you know how to calculate? Yes or no? All of you? All of you?
Yes, ma'am.
Yes, because once you know how to calculate BMI, already normal value is given. So you just take your weight, you just take your height, and then calculate it. If you come under this normal range or in this range which I have given you after calculating, then you can like identify yourself. Oh, I am in this category. I'm in this category. Is it okay? Yes or no?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, okay. So that maintaining of weight, this is also another lifestyle changes, okay, which you can change in order to reduce all this the blood pressure that is associated with the kidney disease. So with this, all the health problem can also be this decrease. Then quitting smoking, quitting smoking. This is smoking, especially for boys. Quitting smoking. If you smoke, no, you should quit this Eshital, all those, even girls also nowadays, girls are also not less than boys nowadays. Isn't it, Samuel?
Ma'am, we don't smoke.
Oh, yes, yes, I know. It's no
Yes, ma'am.
problem. Means like nowadays, like some people like smoke. Now, if you find out in future, you never know, na? So never smoke. So if you smoke, you should always quit smoking because smoking, kya karta hai smoke karne se? Smoking, it damage our blood vessels, okay, which is very bad. So so it damage our blood vessels. तो हमारा blood vessel damage होने से क्या होता है? So that will raise the chances of developing high blood pressure, okay, which is very bad. So and it also like worsen the health problem that is related to this high blood pressure. If you have any kind of health problem, that is any kind of kidney disease, okay, any kind of health problem, which is also like means in relation with high blood pressure, so that will increase if you smoke. तुम्हारा किडनी डिजीज है ऊपर से you have high blood pressure also and and in the same way you are also smoking, then obviously the only option left is do or die. Means like you have to quit smoking in order to like means in order to like prevent your blood vessels to be damaged. So that's all about the smoking. So are you clear about these lifestyle changes? How it can like reduce the blood pressures? Are you clear till quitting smoking? Yes or no?
Yes, ma'am.
Okay, okay.
Yes, ma'am.
Okay, let's move on. So
Yes,
let
ma'am.
the next is what is the other lifestyle changes? Let us see. Managing stress. So managing stress, okay? So stress means what? Stress means बहुत ज़्यादा tension लेना, all this stress ना. So learning how to manage stress, okay, relax and cope with any kind of problems can improve your this emotional and physical health. Okay, this managing stress is very, very much important. Means ज्यादा stress लेने से भी like that can affect your blood pressure to release. जब exercise जैसे कि when you relax when you check your blood pressure, okay, at that time your blood pressure is increase or decrease as compared to the times you take exercise. So after exercise and before exercise you check your blood pressure, it will be totally different. So in the same way when we take stress, okay, ज्यादा stress लेने से भी बीपी high होता है. And then if BP high होने से तो the other kidney disease or any kind of health problem you will have, that will affect more and more. So managing stress is very much important. So you yourself try to learn how to relax and cope with all kinds of problem or situation, okay? And it's especially emotional, physical health, all this very important. So in order to manage stress, what we people nowadays we mainly do is that there are some activities that used to help us to reduce the stress. So what are those activities? जब stress होते ही तो क्या करते हैं? शीतल, in order to
Playing
relieve,
game.
in order to relieve that stress, what you want to do?
And gaming.
Oh, okay. Who else? Darshana, what do you feel like doing if you have stress in order to relieve that stress? Okay. Do you all listen music? Yes or no?
Yes, ma'am.
Yeah, so there are some activities, okay? There are some activities that used to help us to reduce our stress, okay? Do follow all those activities. First of all, try to be physically active, okay? Even if you are stressed, try to be physically active, and then try to practice some yoga, all these things, okay? Yoga and all, and then listen music. Listening to music is very, very much like helpful, okay? And then like you just try to focus on something that is calm or peaceful, okay? Just all those things. And meditation, you know now meditation, all of you, meditation.
Yes, ma'am.
Okay, all those meditation, all those can help you with this manage the stress, okay? These are this is also another lifestyle changes जो हम खुद कर सकते हैं in order to prevent. So all this is very, very much helpful for our daily life apart from all the medications. So next, following a healthy diet including less sodium intake. So following a healthy diet is very much essential, which I already keep always mention ना, किसी का hypertension होने से salt कम खाने को बोलना है. All this I keep on repeating. So following a healthy eating this plan, okay, this also can help you lower your blood pressure, okay? So reducing this amount of sodium in your diet, okay, these are all the like important part that you can take step, okay, in order to reduce it. So have you ever heard the term DASH, the full form of DASH dash DASH? Any one of you? If not, you write it down. DASH. DASH. We just used to like know this abbreviation, but if you want to know, dash. D stand for dietary, S stand for approach, and approach to, S for stop, and then H for क्या होगा? Dietary approach to stop. H will be what? What are we discussing today about? H for?
Hypertension.
Yes, very good. Hypertension. So dietary approach to stop hypertension. Okay. ये एक eating plan होता है. Okay. This dash ना, it mainly like this is the eating plan. Okay. That this hypertension patient and all they used to follow all this dash eating plan. Okay. This is like you have to like what to take. You have to mainly focus on the fruits, vegetable, whole grains, all these things, and you have to lower your amount of the fat that you intake. It's not that हमको totally fats nahi khana hai. It's not like that. If you take also, you have to lower the intake of fat. All these are the DASH eating plan. That is dietary approach, okay, to stop hypertension. If you want to stop hypertension, तो ये सब dietary plan follow करना है. So it means like some salt कम खाना है, take less amount of salt, and then like take low amount of fat, cholesterol, all this. Take this milk and all, okay, but with less amount. And then dairy product, these fish, all these nuts and all also have, but everything with less amount. Okay, so these are some of the lifestyle changes. ऐसा करने से you can also improve your health problem as that is associated with this hypertension. And then if you have only hypertension also, like that can also help you to reduce. So ये सब follow करने से तो like you just consider yourself that your lifestyle will be, or your lifespan will be long, because if you follow all these lifestyle changes. So are you clear with this? Are you clear with this point? How to prevent or slow this? How to prevent or slow the progress of kidney disease? from high blood pressure? Are you clear with all this point, all these steps?
Yes, ma'am.
All of you?
Yes, ma'am.
Ma'am.
All of you?
Yes, ma'am. Yes,
Okay,
ma'am.
okay. So let us like discuss, okay, from the first whatever we have discussed today. So let us just revise. So okay, let us have one revision, and then if there is time, I will try to show you. Oh, you can see the slide now? Yes or no?
Yes, ma'am.
Okay, let us
Yes, ma'am.
revise first. Okay, renal hypertension, you know that this is the kidney hypertension. Okay, जब kidney का any kind of kidney disease occur, okay, that will be associated with this hypertension. So that is the renal hypertension, और उसका दूसरा नाम है renovascular hypertension. The other name is renovascular hypertension. So this hypertension, that is renal hypertension, we can mainly control with the help of blood pressure drugs. Okay, let's move on. All this, no need to repeat all these things. How does high blood pressure affect the kidney? When there is a narrow in our blood vessels, na, the blood vessels narrow hota hai. We have two kidney, maybe the two kidney blood vessels might be narrow, okay, might be damaged, so that will hamper the kidney, and there will not be like proper removal of all the waste or extra fluid from our body, okay, and that extra fluid can that extra fluid present in our blood vessel, okay, can raise our this blood pressure. Okay, जो blood vessel में जो extra fluid होगा ना, जो तो उसका वजह से हमारा blood pressure raise हो सकता है. So that are all the some of the like condition that affect the kidney. So you already know that. And who is more likely to have kidney blood pressure or kidney disease? All these I explained. Older patient, family member, unhealthy lifestyle. Yes, male are more. All this I have already explained. Or kidney disease, जिसका diabetes है, family history of kidney failure. All this. And then next, what I have causes. All these causes. What are the causes? Okay. Okay, then if the cause is by narrowing in the arteries that deliver the blood to the kidney, okay, there is one artery, okay, that there is some particular arteries that deliver the blood, हमारा blood को deliver करता है to the kidney. So वो artery में narrowing होने से क्या होगा, that can cause renal hypertension. So that is the main cause. So ये narrowing in one or both renal arteries is most often caused by atherosclerosis. Atherosclerosis I already explained. All these less common cause kya tha, fibromuscular dysplasia, all these things. So clinical features, all these things: headache, confusion, blurry or double vision, diplopia, bloody urine, nose bleeding, all these things. Or treatment or medication, mainly you should know angiotensin converting enzyme, all these things. Don't forget, okay, this Ishan, Sital and all. Next time don't say that I don't know, okay. So angiotensin converting enzyme, all this, angiotensin receptor blocker, what are the name of the drugs, all these things, try to know. And then along with this, if the patient, like if the patient is not enough or treated with one medication, so two or more medication might be needed to control the blood pressure, okay. So in addition with the angiotensin converting enzyme medicine and angiotensin receptor blocker, we also prescribe diuretic, okay. जो diuretic का मतलब है medicine that help the kidney to remove fluid from the body, means from the blood. जो हमारा blood में जो extra fluid था ना blood vessels में, जिसका वजह से like वो है pressure raise होता है, blood pressure raise होता है, to remove that fluid, okay. So that diuretic is given along with all this. So that was all about the treatment. And just now I have discussed all about the important lifestyle with such a like understandable explanation. So all of you clear about this hypertension associated renal disease and as well as how to prevent. Are you clear? All of you? All of
Yes, ma'am.
Ma'am.
I I think it is very, very much clear enough. I think so. So, okay, now let's move on to some like important questions. Okay, if there is time, we will discuss at least 5 questions. The day I gave you all till 67, I think. Is it 67? Then I send you all the PDF. Malvina, is it 67? I think 41 to 67. Malvina?
Yes.
Okay, okay. Okay, can you see the slide?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, okay. So number 1, we already discussed now that they excess unused glucose. We already discussed, isn't it? Yes or no? Yes or no? We already discussed that this excess unused glucose in the blood may damage nephron. Dibyajit, please take attendance, okay? Dibyajit.
Yes, ma'am.
Okay, okay, please take attendance. Okay, only 10 minutes left, so let us be in hurry. So number 1, I already teach you all that day. I did not send the PDF, but I already teach you all this. So, and then number 2 is systemic disease, which may cause chronic renal failure is this one is the one, there is a systemic disease, okay, which may cause chronic renal failure, okay. The answer is GOUT, G-O-U-T, and diabetic this nephropathy. This GOUT disease and this diabetic nephropathy, okay, these are the name of the systemic disease, okay, which may cause chronic renal failure. So try to by heart these two. Okay, 69. Next, coming to the next point. So in nephrotic syndrome, which symptom is very common. So in nephrotic syndrome, which this was my part. So in nephrotic syndrome, which symptoms is very common. So in nephrotic syndrome patient, do we find dysuria?
Yes, ma'am.
Okay. Did we find frequent micturition? Frequent micturition? Array nephrotic syndrome.
Yes, ma'am.
Okay, fever. All this fever. We find frequent micturition. Are you sure? Okay. Did we find fever in nephrotic syndrome? We find
No,
fever.
ma'am.
No, isn't it? Okay, that is why like in nephrotic syndrome, in nephrotic syndrome, which symptoms is very common. So among all this, okay, dysuria, frequent micturition, and fever, all these two are very, very much common, okay? That is dysuria and frequent micturition. This is very common. This fever might occur, but it is not common, okay? It is the least condition or the least symptoms that can occur. So dysuria and frequent micturition, these two are the answer. So if it come, you have to choose option A and option B. So in number D, it is written A and B both. So that is why option D is correct. Are you clear with this? Are you clear? These are the
Yes,
common.
yes.
Okay, okay. Okay, let's move fast. So next is that day I already discussed this azotemia, that day. So azotemia I explained. So next we'll move to this. Pyelonephritis is common in women due to, so pyelonephritis is common in women due to, okay, due to short length of urethra. So if the urethra, okay, if the in women, not in men, okay, in women, if the urethra is short, okay, there is a chances of developing pyelonephritis. So there is a chances of developing this pyelonephritis. So try to remember this, okay. So are you clear? अगर वुमेन में उसका यूरेथ्रा शॉर्ट लेंथ है तो उसका पायलोनेफ्राइटिस, देयर इज इन्फ्लेमेशन ऑफ द किडनी होने का चांसेस है. आर यू क्लियर? Yes or no?
Yes, ma'am.
All
Yes,
of you?
ma'am.
Yes. All these are, you just need to know anatomical proximity of urethra and anus, or if there is anatomical proximity of urethra and anus as well, then that also can lead to this pyelonephritis, especially in women. So that is why option A and B both are correct. So that this is the number C option. That is why option C is correct. So next, azotemia we already discussed, and 71 we did not discuss. 71, let us see. Microscopic examination of urine of urinary tract infection patient reveal which of the following. So see microscopic examination of urine of urinary tract infection patient. इसका मतलब है ना कि you there means the patient is suffering from urinary tract infection. Okay, so we are collecting his urine and then we are going for microscopic examination. We are going for urinalysis for examination. So after examining the urinary tract infection patient urine, so what are the findings that we get? Okay, so there will be a plenty of pus cell, which is correct. क्योंकि वो है urinary tract, अगर उसका urinary tract में infection है तो you will find there is in his urine, in his or her urine, you will find lots and lots of pus cell present, and you will find plenty of epithelial cells, and you will find the presence of RBC. Okay, this hematuria and all you used to find. So that is why all of the above, option D is the correct answer. So are you clear? All this I already discussed. Pus cell pus formation होता है, वो cloudy urine, all this you used to see ना, plenty epithelial cell, this WBC and all you used to find presence of RBC. Are you clear with this? 71? Are you clear with the questions? You understand the questions?
Yes.
Yes, ma'am.
It's very easy. Okay, the question is very simple. The patient is the urinary tract infection patient is coming in front of you. He is giving he or she is giving her urine for investigation. So you are doing that investigation, testing of urine you are doing. Then after that you find that uska urine में बहुत सारा pus cell है, plenty of epithelial cell, plenty of presence of RBC. That means that will indicate, okay, that he have urinary tract infections. So these are some of the questions. So I will be sending you all this question. Okay, PDF 68, 69, 70, 71, 72, 73 we have discussed. Azotemia we have already discussed yesterday. So are you clear with this much question? 1, 2, 3, 4, 5. This 6
Yes, ma'am.
question? Okay, okay.
Yes, ma'am.
Okay, these are very important. Okay. Okay, I think that much is enough for today. I'll send you all this question. Okay, then. Okay, then you are clear now. Whatever we have discussed from morning, everything, hypertension associated renal disease. No need to repeat or revision again.
Yes, ma'am.
Next. Okay, all of you?
Yes, ma'am.
All of you? I could hear only some of them saying yes, yes. Others I could not hear.
Yes, ma'am. Yes,
Yes.
Okay, okay. Okay, then I will be sending you all that PDF. You write it down again. Okay, all those questions, don't just ignore. Don't just open, download, and keep it, because later on it will be very helpful for you all in your final exam. Okay, then that's all for today class. Okay, so okay, then thank you everyone.
Thank you, ma'am.
Thank you, ma'am. Thank you, ma'am.